Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to another lecture of kinesiology. As we know, the most of the content of our syllabus have been covered until now. Today, I'm gonna revise the concept of passive movement. My name is Dr. Zahra Gillani, DPT gold medalist and master's I'm doing right now from Rifa International University, that is in orthopedic manual therapy. I'm also your course instructor of kinesiology too. Let us continue with what we had decided that in today's lecture we will discuss what passive movements are. So, our learning objectives of today would be knowing the basic concept of passive movements. Then we will see what is the classification of passive movements. Then how a physiotherapist can do it and how independently the patient can perform or with the help of the other limb he can perform the passive movements. Then we will see what are the indications of the passive movement. That what are the conditions where passive movements are being required in the therapy, and we will see some principles of performing the passive movements, that how the passive movements should be performed. Then there are some types of the passive movement. There could be relaxed passive movements in which where there are physiological movements and accessory movements. Physiological are mostly performed on its own in a simple manner by the therapist, and the accessory movements are the special techniques that the therapist can only make on a joint. And then we will see what are the effects and uses of them, and moving to the other type of passive manual mobilization and the manipulation techniques, and we will also see their uses and effects. Let us start with today's topic, which is passive movement. That when the movements are performed in unrestricted range of motion by some external force due to the muscular weakness, or when the muscle is voluntarily reduced to relaxed position. There is a misconception about passive movement, that they are only performed when the muscle is weak enough and not able to move on its own. But that's not the case. Actually, when we want the patient to voluntarily relax some of its muscle, we use passive movements in order to relax the muscle that is going into lengthening position by performing that movement. Taking the example of biceps and triceps, if I want the tricep of that patient to relax or lengthen, though the biceps are also strong as well as the triceps are strong, but due to the spasm, or let's say due to fatigue, I want that muscle to lengthen or relax. I will perform passive elbow flexion on that patient, making the bicep contract and tricep to elongate in order to relax. These kind of techniques can also be used in order to relax a spasmatic muscle or the fatigued muscle. Then there could be an external force that is applied, obviously, in order to assist the movement or to help complete the range of motion of the movement. That external force can be applied by the physiotherapist itself, or the patient can also perform some of its movement on his own. For an affected limb, he can use his sound limb to perform the movement that is required to make passive, or help himself to move the other limb. Similar goes to the lower limb as well. Then comes the gravity. Along with all the passive forces that are being produced by the therapist and the patient itself, gravity is also acting as an external force that is helping the patient to relax, or in order for the range of motion to get completed. One of its example is when a patient is on couch and we have to achieve elbow extension, or let's say shoulder extension. We will make the patient lie on the edge of the couch, having the one shoulder, the affected shoulder or the subjected shoulder of the couch, and then we will ask the patient to just relax his arm and let the force of gravity to act on the joint. And that force of gravity will ultimately pull the limb towards itself and make the movement complete. So different types of such movements can also be performed. Similar goes by taking the step when a person is moving against gravity and also the gravity is acting to help him to move his foot down. So any machines can also be used on the other hand along with all these manual or the human active forces. The machine or the mechanical forces can also be used to assist the movement that is to be performed. Then comes the passive movements. So the passive movements could be of two types as we saw. They can be relaxed passive movements or they can be passive manual mobilizations. The relaxed passive movements could be physiological and accessory. We'll see what the details of that. And there are some passive manual mobilizations in which there is the simple mobilization of the joint, and then comes the manipulation of the joint, that is mobilization with the first thrust, and then comes the controlled sustained stretching in order to relax the muscle. That is also performed passively and it's included into the passive movements. What would be the indications of these passive movements? Well, the muscular weakness is the very big indication to perform the passive movement on the patient, but remember always that this is not the only thing to consider. But considering it as the very first indication of passive movement, this muscular weakness can be caused by different reasons. For example, there could be an acute muscular injury resulting in the deformation of the joint or the involving the instability of the joint as well. Also the muscles would go weak after the acute injury. There is need to make them protected and to keep them in the protective spasm as well. So to resolve that we have to perform passive movement. Then comes the inflammation. So, if a muscle is having an inflammation or an area is having an inflammation, there could be a muscle weakness as a cause and as a result as well. So, when comes the neuromuscular deficiency, we can say that there is a lesser nerve supply to the muscle that has to perform a movement. So if the nerve supply is not enough, that muscle is not going to perform its movement or the its character or action to its full. So there is a need to assist that kind of movement with the help of passive movements. Then in comatose patient, where we want to preserve the properties of the muscle, where the patient cannot move it on its own, and we have to preserve its function by helping the patient to perform it. Then comes the bedridden patients. So, what's that? It actually means that all the bedridden patients who cannot move on their own due to the disabilities or deformities they have caused in their life, or let's take an example of the polio patient that spends most of its time in the bed, or a stroke patient and a hemiplegic patient who is going to spend most of its time in the bed. Most of the muscles are going to get weak. So the passive movement can be produced in the form of rehabilitation as well as a preventive measure in order to keep and maintain the properties of those muscles. Then what would be the techniques and the protocols that we can use while performing a passive movement? There comes the starting position of the patient as a therapist or the joint as well. Then how we can induce the relaxation over that muscle in order to let the passive forces to complete the range of motion. Then what would be the fixation of the origin of the muscle, how we can do that. Then there comes the support for the patient that is required, that which body part need to be supported the most is to be taken in consideration. Then comes the traction. So any movement, passive or active, performed along with the traction of the movement will ultimately result in adding up to the effect of that movement or to adding up to the efficiency of that movement to be better. Then comes the range. So it is required to know that what range we want to achieve, whether we have to start in the initial range and go to the end range, or we are going to start to the end range and end up in the middle of the range or something like that. Oh, that is all up to the condition of the patient and the therapist to see. Then comes the speed and the duration. So, what will be the speed of the passive movement that you are going to produce in a patient? So, we are literally going to pull the muscle in a slower motion. So, slower the movement, the more learning effect that produces in the patient's mind. For the assessment and examination purpose, these passive movements can also be used. So, how these are going to be used for the assessment and examination purpose? In order to find the good end feel of a joint, there is need to perform the passive movement. As the end feel is the qualitative property of a joint, it can also only be achieved by the passive movement and an overpressure at the end of the movement. Or to check the stability of the joint, some passive movements are performed. In that order, the hands of the therapist can literally feel the feeling of that joint or the effect the joint has been creating. Then comes the muscle strength. So, MMT is a part of the kinesiology where the manual muscle testing is being performed with the help of the hands of the therapist, which is being carried out through passive movements again. Or sometimes the movement is performed by the patient while you have to assist it at the end of the range. Then, in order to assess or examine the limitation of the movement, so where the limitation is coming, either the joint is unstable or the ligament is weak or ruptured, is there a crepitation in the joint, or the muscle is being weak while the motion is limited. So, in order to assess all these reasons, there is need to perform the passive movement or to teach an exercise program. So, how does this relate to the passive movement? When we start a program with our patient, an exercise program, we need him to understand all the concepts clearly. How that happens, that I am going to demonstrate it in front of the patient, or I am going to perform it passively on the limb of the patient in order to him to learn that movement more properly. So the second one is more preferred and have more benefits towards the patient. Then comes the patient perception before the application of the technique. So before we're going to apply any technique on the patient, there is need to demonstrate that technique on that patient in order for him to understand better what kind of technique I'm going to perform on that patient, and that eventually develops the trust of the patient in the therapy as well as the therapist. So this was all for how the passive movements can help in different purposes in the therapy, as well as it is going to help the therapist to assess and examine most of the conditions of the patient, as well as we can also demonstrate a lot of techniques in the exercises that we are making the patient to perform. So the next comes the passive movement. There could be the relaxed passive movements, there could be the passive manual mobilizations. The first we will discuss about what relaxed passive movements could be. So here the patient is not making any effort. All the movement is being performed by the external force or that can be assisted by that. The very first in that is the physiological movement. So what the physiological movement is, when the physiotherapist moves the part of the body smoothly and accurately in a viable range, it is said to be the physiological movement. So these are all the anatomical movement that the therapist can perform. For example, the flexion of the elbow, extension of the elbow, abduction, adduction of the shoulder, or we can see the extension and the flexion of the shoulder. All these movements that are the physiological, and the patient can also perform actively when he was normal or with the other normal limb. The therapist, when perform these movements, these are known as physiological movements that the therapist is going to perform. So here, the movement of the body levers come, that the part of the body is going to move over a joint in the form of a lever. So these are these kind of movements, normal physiological movements. For this, one be aware of the anatomy of the structure. So, knowing the anatomy of the structure makes the person able to flex the elbow to move the joint, and the end field of the joint should be good, as well as the range of the motion should be in the information of the patient, of the therapist who is going to make a movement complete. So if we have all the knowledge of these normal physiological movement, it becomes easier to perform them in the form of passive movement as well. And again, the patterns of the movement should also be recognized and remembered and be known by the therapist who is going to perform these movements. And after that, there comes the accessory movements. What accessory movements are then? These are the movement which are the part of the normal physiological movement but cannot be performed isolated by the patient itself, but can be performed by the physiotherapist. So these are only the movements that the therapist can perform and he know how to perform. So when a person is performing normal movement, for example, he's flexing his elbow on his own will with the complete range of motion, these small accessory movements or the joint play movements are already occurring in the joint in the normal movements. But if we ask the patient to isolate those accessory movements, small joint play movements in their body, it's impossible for them to isolate them. So these movements are isolated with the help of physiotherapist only. So these movements are the joint surface movements. How? That as the inflection and extension, the limb is acting over a central point in the form of lever. Here, in the accessory movements, only the movements at the joint surfaces is being considered. That we don't want the whole bone to move over a joint, we just want the surfaces to move over one another in this direction, or in this form, that maybe the apparent movement is not being seen, but the movement over the joint is being seen. Here is an example of accessory movements. So it includes sliding, rolling, and spinning movements. The one of them is this rolling, where every new point is coming in contact between the two surfaces. Then comes the slide or the gliding, where the one contact point of one surface changes the contact point with the other contact points of the surface. And then comes the spinning or rotating kind of movement, where the surface is going to rotate on the other surface. Again, here the single contact is coming in a single point is coming in contact with the other. So the first one is rolling. When the new point on one surface is coming in contact with the new point on the other surface, see it like this. If it is one articulating surface, this is the other articulating surface. This is the one contact point. This is the second contact point, third contact point, fourth contact point. So all the contact points in this surface and this surface are new. One to one, two to two, three to two, right? So this is what we call a rolling movement. Then comes the sliding movement. When the same point on the surface meets the new point on the other surface. What does that mean? That only this point of this joint surface, or this bone surface, is going to now slide on this surface. How? Like this. Okay? So only one contact point of one surface is coming in contact with the new point on the other surface. 1 to 1, 1 to 2, 1 to 3, right? So then comes the spinning movement, where the rotation of the segment is about a stationary axis. Let's say the axis of this joint surface is this, like this. It's passing from here, like this, and I want a spinning movement of this bone over it. So along that axis, this bone is going to move like this, and this is called spinning movement of that joint. Then comes the effects and uses of the physiological and accessory, or let's say the relaxed passive movements, in which the first one is prevention from the adhesion formation, very effective and very meaningful. that we want to protect the joint from making adhesions on its capsules, which is the side effect of being immobilized. So, while the patient cannot use his own limb, we make that patient use his limb with our force, or the, let's say, the force of gravity, or the mechanical force, let's say, the passive forces. Then, to preserve the memory of the pattern. So, if a patient doesn't perform one single movement for a longer time, he is ultimately going to forget that movement pattern in his brain. That's going to get erased. It's just like we have not revised a topic for a very long time and we have just forgotten that. So, to preserve the memory of that movement, we make them perform passive movement of those joints. Then, to maintain the range of motion, how this can be done, that the in order to prevent the adhesion formation and the weakness of the muscle, we are ultimately maintaining or keeping the range of that joint to its normal range. Then, to improve the blood circulation, how the blood circulation can be improved in a joint, it is how the muscles contract, and all the contractile structures over a joint are contracting and relaxing, and the blood circulation or the pumping to that area due to the contraction of those muscles is being increased, and ultimately the whole increase in the circulation of that area is resulting, as well as another effect of relaxation is being produced in that moment. Okay, to prevent the adhesion formation, in case of non-mobility, there are chances of adhesion formation in the joints. It can be prevented by passive range of motion on one wall, given the passive movement and the frequent intervals of time is sufficient. So the passive movement that is performed on the specific intervals of the time gives the positive effect to the body of the patient or the joint that is under consideration. And for practice, it is performed twice daily. So we have to perform these movements twice daily in order to make it go better or good, or to stay in its good state. Then, to preserve the memory, so when the muscle is not able to contract, the passive range of motion helps to preserve the pattern of the movement by stimulating the kinesthetic responses. So the kinesthetic responses are the sensations or the proprioceptive sensations that are present in the joint and make us able to learn those movements. These are being performed with the help of preserved memory that is being gained by the repetitive movement of the passive range of motion. Then comes the maintaining the range of the movement. How we can maintain the range of the movement? So if the muscle do not contract, it may lead to the adaptive shortening of the muscle. How? Let's say a person has been keeping its elbow immobilized, then the biceps are going to stay in elongated position while the triceps are going to contract it for a very long time, which will ultimately result into the shortening of that muscle and the adhesion formation in the muscles. So the passive range of motion is provided twice daily in order to maintain the extensibility of those movements in available and pain-free range. Next is to improve the blood circulation. So how these blood circulations can be improved? Okay, the passive range of motion puts a slight mechanical pressure and the stretching to the thin walled vessels passing through the joints or the over the joints, and this helps to improve in venous and lymphatic drainage as well. So as the oxygenated blood is coming to the joint, all these deoxygenated blood and the toxins that are being produced on that area are also being drained out if the movement is being produced. So this is how the passive movement is going to help in improving the blood circulation of that area. Then comes the quick and the continuous rhythmic passive range of motion with elevation of the limb, and it helps in the reduction of the edema. How the edema is being reduced in that area? So as the passive movement is being performed, the venous and the lymphatic drainage is being improved in that area, which is ultimately resulting into the reduction of all the excessive fluid in that area, and the edema is being reduced. So what edema actually is the excessive extracellular fluid that has been accumulated in the area is causing the swelling or the pitting of that area, known as edema. So the any movement or the passive movement that we are performing on the joint is helping to reduce that excessive fluid or to wash that out of that area. So the last one, effect of the relaxed physiological movements is the relaxation and the continuous rhythmic passive range of motion that produces the soothing and relaxation effect on the human body, or that muscle, that if we perform a rhythmic slow movement or in the smooth movement on the joint with the help of the therapist or the mechanical forces, this is ultimately going to produce a relaxation effect on the muscles of that patient. And it can also be used in the training of the relaxation of a patient. So when there is required for a patient to train how to relax his body, it's sometimes necessary to contract passively that muscle and then elongate that muscle in order to let him know and realize that what is the lengthening effect is and how my muscle was initially contracted and now it is being relaxed. So, this was it for today. Let us revise the concepts that we have studied today. The number one of that what passive movements actually are. So, these were the movements that are being performed through the external force in order to assist and complete that movement. And we also saw that the external forces could be applied by the therapist, by the patient itself with the sound limb, or through the gravity or the mechanical techniques that can be used in order to perform that movement. And then comes that what kind of classification of the passive movement are there. So there were relaxed passive movements that we studied today, and there were the accessory or the mobilization movements that can be performed on the joint through the passive techniques that we are going to study in another lecture, inshallah. And then we saw that what could be the effects and uses of those movements and what kind of indications are there for the passive movement. So the passive movements can be performed when there is a muscle weakness caused by any injury or a problem or inflammation. And then we saw that what kind of joint assessment and examinations can be performed with the help of passive movement, as well as how the relaxation is being used. So then we saw there were some passive physiological movements and there were some passive accessory movements. So the physiological movements were the liver-like movements that were occurring around a joint at the movement of the bone, and then the accessory movements were the movement of the joint surfaces that was being happening within the joint if there was no need of moving the bone itself, though it can also move. So, and these movements can only be specifically performed by the physiotherapist. So all these movements eventually help to increase the blood flow, the drainage flow, the relaxation of the muscle, the lessen the edema, as well as the remaining and remembering pattern of that movement. So we aim to study in our next lecture about what mobilization and the manipulation techniques are, how they are being considered in the passive movements, and how these can affect the body, and what are the uses of these movements, and what are the indications of these movements. So thank you so much. So if it is important to you, you will find a way. And if not, you will find an excuse. So if it's important to you, never find an excuse. Find a way to help it. Thank you so much, everyone. Hope to see you in our next lecture.